is Tion Woods. I'm a nurse practitioner and a DNP student at Brenham University. I'm here today to speak to you about my clinical scholarly project. Welcome. My clinical scholarly project is about African Americans, males over the age of 65, and acute care stroke management in the rural health setting. Like this 1956 Ford Fairlane 500 convertible, one of the first production models. You want to take to any old mechanic. You have to manage those patients. You want to make sure that those patients have the best care for them. So my project is going to focus on those patients in rural health settings and having the appropriate care with neurologist expert in the house. So we'll start looking at some of the stakeholders that I involve. The first group of stakeholders I met with the education committee. I met with the education committee. They were selected because I had to do the study here, and that's one of the requirements to meet with the education committee to see if this was the appropriate site that they could meet my needs. So I met with the education committee, and we decided that I would obtain informed consent. The surveys will be given to providers, and the survey will be anonymous. We also looked at asking patients volunteering for the studies, and we assured patients that the identity of the sponsor will be kept confidential. Some of the objectives that we discussed, we looked at the management of African American males. Some of the objectives, we wanted to provide a heightened awareness of cultural differences and healthcare needs in the participants. Participants will gain an in-depth health assessment to decrease future risks of strokes. We distribute up-to-date information, up-to-date evidence-based practice guidelines for the management of the stroke in acute settings. We also look at education of participants addressing the serious impact that untreated symptoms can have on patient quality of life. The next group of stakeholders we needed buy-in from were the neurologists, the physicians, the one actually providing care. We met with the neurology provider team, which include the neurologist and a nurse practitioner, a neurological nurse practitioner. And we discussed how our plans for capturing data and implementing the studies. The providers that were not available to attend this meeting, we offered individual meetings as needed. We wanted to ensure that most, if not all, the providers provided with the same information, that they would have access. So we provided a small pamphlet for the ones that were not available. We also reviewed some of the therapy guidelines, like certain tests such as head CTs that must be performed. If the neurologist were not in-house, the utilization of the RP Vita, the robotic unit that will allow the neurologist to remotely log in and manage patients remotely. We also looked at streamlining the process using the code stroke. Next, as far as buy-in, we looked at the leadership. I was surprised, but we got a meeting with the CEO, Patrick Brigant of Riverside Community Hospital. Met with him, I met with the CNO, and also met with other members of the leadership team. And I explained to them some of the benefits of having this study. Riverside Community Hospital is part of a HCA hospital. It's actually the 12th highest grossing hospital in the United States. That was very interesting to find out. This hospital is a for-profit healthcare system. It's been around since 1901. The hospital has long served the community of the Inland Empire for decades. It's providing comprehensive health and specialized care. The medical system has about 1,900 employees and 400 physicians. And during my interview process with the CNO and obtaining buy-in, and with CNO, we spoke about the potential benefits, and also recruitment was one of the, bringing some of the leading experts in neurology care and stroke management to the department. and they were very interesting. Very interesting meeting. It went very well. They were all for it. So next we're going to look at educational interventions. So we spoke about provide education to neurology team, also provide education to the patient, also provide education to other ER staff members who are one of the first lines of care seeing these patients. Some of the ER staffs, even though they are aware of the RP Vita, the app that they use in a robot, the integration of a robot that you use with patients, it's not always the first thing they get when they see stroke patients. So alerting them some of the signs of stroke, even the guidelines as far as cold stroke. So looking at it and reviewing that with this department. So I make sure that there was the value in being an acute stroke center. RCH is already a stroke center, and I let all the stakeholders know, the CNO, the leadership team, the neurology department, the ER department, and education committees, that the benefit, some of the benefits of doing this study will allow them to become the leader, allow them to be a center for innovation. The CNO spoke on possibly becoming a magnet hospital. And I told her with this information and having this type of study and this access to a higher echelon of care for stroke patients would allow for better nurse retention, better recruitment of physicians, especially physicians at neurology base, and also better selection. Patients will be able to read this study or be able to see their local hospital, Riverside Community Hospital, in the papers or in journals, and will choose Riverside as a place to go for stroke management. So implementing this plan, implementing my plan, I looked at strokes in general. Rural areas often struggle with managing stroke patients. After a review of studies, the premise of the suggested solution in the management of stroke patients is the creation of telemedicine units. So having the Riverside community be a leader and create a telemedicine unit of neurology experts that will be the basis for acute stroke management. Riverside community is one of the acute stroke centers in the area. The other closest one is probably about 25 miles away at Loma Linda. And being one of the leaders in stroke, they could be a resource, and this could start a trend. And they could be one of the first. So implementation of prior implementation, I mentioned what we would do. As far as implementing the project, we went this clinical scholarly project, the last approximately 6 months. We looked at participation. We spoke of participation of patients. The target demographics is African American males over age 65. We talked about educational meetings prior to implementation with the education committee, neurology team, and the ER staff. And as far as is this plan feasible for this department? Riverside has the financial resources. They're very interested in innovation. They show this constantly by being one of the leaders in accessing new equipment. They're one of the first in the area as far as the RP Vita, and they also they're doing expansion currently. So the CNO expressed an interest in becoming a magnet hospital. Just to go back to look at the neurology department, the neurologist that's currently there that I spoke with, the chief neurologist, he informed me that the telemedicine robot they currently use is pricey. It's about $5,000. They lease it approximately $5,000 a month. They have one machine in place. but the benefits way outweigh the costs. If you can even save one life, the neurologist mentioned, it makes it worth it. But she was concerned. She looked at possible scenarios where multiple stroke patients would come in. They don't have one machining staff. And I mentioned this study could influence the department to purchase more machines. And some of the studies I reviewed showed that telemedicine units, the creation of telemedicine units, allows for 24/7 coverage, and this helped to decrease the margin of error. Actually, has a low margin of error. On average, is about 300 strokes per 10,000 people. Rural health hospitals may only see a limited number of patients presenting with stroke symptoms. This further complicates matters as urban hospitals see them regularly. Riverside, for example, sees them very regularly. The rural ED irregular exposure to such patients can hinder awareness of current stroke management guidelines. So the creation of this project will allow hospitals such as the San Bernardinos, the other Inland Empire small hospitals, the Menifees, the high desert hospitals to manage these patients more effectively. The project will follow the patient in the admission process. Patient treatment and care will be reviewed. Patient will get a follow-up questionnaire 1 month after discharge, and use this result. The data will be given to medical centers